Here is an in-depth explanation of gonorrhea, covering all 18 points you've requested, with a high level of detail appropriate for medical and nursing studies. 1. Introduction. Gonorrhea is a bacterial sexually transmitted infection that has affected human populations for centuries. Caused by Neisseria gonorrhoeae, it commonly infects the mucous membranes of the genital tract, but it can also affect the rectum, pharynx, conjunctiva, and even spread systemically. If untreated, it can lead to serious reproductive and systemic complications. Increasing antibiotic resistance has become a significant concern globally, necessitating urgent public health intervention. 2. Definition. Gonorrhea is a contagious STI caused by the gram-negative diplococcus, Neisseria gonorrhoeae, which invades and infects mucosal epithelial cells. It is typically transmitted through vaginal, anal, or oral sex, or from mother to child during childbirth. The infection can be asymptomatic or present with genital discharge, dysuria, or pelvic pain. 3. Etymology. The word gonorrhea originates from the Greek words gonos meaning seed, rhoea meaning flow. Ancient physicians thought the purulent discharge seen in infected men was semen, hence the name gonorrhea or flow of seed. The term reflects historical misunderstandings of the infection. 4. Epidemiology. Global incidence. According to the World Health Organization (WHO), there were over 82 million new cases of gonorrhea worldwide in 2022. Age group. Most common in sexually active individuals aged 15 to 24 years. Gender distribution. Affects both males and females, with females often asymptomatic initially. Geographical variation. Higher prevalence in developing countries, urban areas, and marginalized populations. Rising antibiotic resistance, multi-drug resistant strains are becoming a global threat to public health. Gonorrhea can manifest in several anatomical sites. 1. Urogenital gonorrhea, men, urethritis, women, cervicitis, urethritis. 2. Rectal gonorrhea, common in individuals who engage in receptive anal intercourse. 3. Pharyngeal gonorrhea, often asymptomatic from oral sex. 4. Ocular gonorrhea, especially in neonates, can cause blindness if untreated. 5. Disseminated gonococcal infection, DGI, spread through the bloodstream to joints, skin, and other organs. 6. Causes caused by the bacterium Neisseria gonorrhoeae, transmitted through unprotected vaginal, oral, or anal sex. Perinatal transmission, mother to child during birth. Sharing contaminated sex toys. Incubation period, 2 to 7 days after exposure. Risk factors. Multiple sexual partners, unprotected sex, previous STI history, young age 25 years, men who have sex with men, MSM, inconsistent condom use, low socioeconomic status, substance abuse, alcohol, drugs impair judgment. 8. Complications. In females, pelvic inflammatory disease, ectopic pregnancy, infertility, chronic pelvic pain. In males, epididymitis, infertility, prostatitis. In both sexes, disseminated infection, arthritis, dermatitis, endocarditis, increased HIV transmission risk, conjunctivitis, especially in neonates, septicemia. 9. Pathophysiology, step by step. 1. Transmission, entry of Neisseria gonorrhoeae via mucosal surfaces. 2. Attachment, bacteria attached to non-ciliated epithelial cells using pili and outer membrane proteins. 3. Invasion, bacteria invade epithelial cells, avoiding host immune detection. 4. Multiplication, rapid intracellular replication and release into the submucosa. 5. Inflammation, neutrophils and immune response cause purulent exudate. 6. Spread, local, urethra, cervix, rectum, throat, ascending fallopian tubes, PID, systemic bloodstream, DGI-7, tissue damage due to inflammation and immune reaction leading to scarring, fibrosis, and obstruction. 10. Signs and symptoms. In males, urethral discharge yellow-green, dysuria, painful urination, testicular pain or swelling. In females, increased vaginal discharge, dysuria, intermenstrual bleeding, pelvic or abdominal pain, often asymptomatic initially. Rectal gonorrhea, discharge, itching, pain, tenesmus, feeling of incomplete evacuation. Pharyngeal gonorrhea, sore throat, no symptoms in many cases. Ocular gonorrhea, redness, swelling, pus discharge. Disseminated gonorrhea, fever, polyarthritis, skin lesions. 11. Diagnosis, nucleic acid amplification test. Preferred test, highly sensitive and specific. Gram stain for urethral samples in symptomatic men shows gram-negative diplococci inside neutrophils. Culture, for antibiotic susceptibility, especially in treatment failure. Other tests, urine test, endocervical or urethral swab, throat or rectal swabs, site-specific. 12. Nursing diagnosis, risk for transmission of infection, acute pain related to inflammation, deficient knowledge regarding STI prevention, anxiety related to positive diagnosis, risk for infertility, especially in females. 13. Medical management, antibiotic therapy, CDC Guidelines 2024, ceftriaxone 500 milligrams IM single dose, 1 gram for patients 150 kilograms. If chlamydia not ruled out, add doxycycline 100 milligram D for 7 days. In disseminated cases, IV ceftriaxone for 7 to 14 days. Partner treatment, expedited partner therapy, EPT. Avoid sex until 7 days after treatment completion. 14. Nursing management, assessment, obtain detailed sexual history, identify signs, symptoms. Patient education, importance of completing antibiotics, safe sex practices, partner notification. Infection control, standard precautions, reportable disease, notify public health authorities. Support, address psychosocial issues like shame, stigma, encourage regular STI screening. Follow-up, test for cure if symptoms persist, retesting in 3 months recommended. 15. Treatment options. First-line treatment, ceftriaxone IM single dose, plus doxycycline if co-infection suspected. Alternative if allergic, gentamicin, azithromycin, not preferred due to lower efficacy. Supportive, analgesics for pain, fluids, abstain from sex until cured. 16. 5 psychosocial interventions. 1. Individual counseling. Address stigma, anxiety, and emotional distress. 2. Support groups. Encourage sharing and recovery in safe settings. 3. Sexual health education. Emphasize STI prevention, condom use. For cognitive behavioral therapy, CBT, for risky behavior modification. 5. Communication training. Help patients discuss STIs with partners. 17. Prevention, abstinence, or monogamous relationships, condoms and dental dams. Regular STI screening for sexually active individuals. Partner notification and treatment. Educational campaigns on safe sex. Ophthalmic prophylaxis for newborns. 18. Conclusion. Gonorrhea is a highly prevalent and potentially dangerous STI, especially due to rising antibiotic resistance. Early diagnosis, prompt treatment, patient education, and public health measures are crucial in managing the disease and limiting its spread. Nurses play a vital role in prevention, care, and support, making holistic care essential for both physical and psychological recovery. Thank you. Have a nice day.